Hello, young man. What is your name?
My name is Brandon.
Brandon. What do you do for a living, Brandon?
I am a surgical technologist.
And what would you say a surgical technologist does?
A surgical technologist maintains sterility in the operating room, assists the registered nurse and the surgeon with whatever it is that they may need. I also make sure that the counts are correct before and after the surgery. It is my job to make sure that I am well knowledgeable in the different equipment in the operating room. And
Do you have, what specialty do you work in? Do you have a specialty that you...
Yes, so my specialty I work in is mostly spine and skull base.
So that's operation on what area of the body?
So the spine, we can either operate through the abdomen, going to the spine, or going into the back. And then skull base will consist of doing operations anywhere between the base of the neck and up. It can include the brain, or in some cases we do go through the nose.
Okay, would you say that the specialty that you work in, which is called neurosurgery, would you say that is a typically complicated specialty to assist in as a surgical tech?
Yes, it is.
Okay.
It's one of the hardest specialties to learn.
Okay, why would you say that it's one of the hardest specialties to learn? Is there a lot of trays? Is there a lot of instrumentation, a lot of equipment?
Yes, so whether you do spine or skull base, there are multiple trays and equipment that you will have to learn and troubleshoot.
Okay. On a given day, on a given case, how many trays would you say you have to be able to navigate through in order to do, like, let's just say semi complicated surgery, not the most complicated, but not the most easy case either?
On average, I do a lot of what are called fusions, which are you're fusing the spine together. And on those cases, you typically have 8 trays, and that's an average.
Okay, so as a surgical tech, what qualities would you say you would need to possess to be really good at what you do? Would you need to be organized, meticulous?
You would have to be organized, meticulous. You would have to be quick reacting.
Okay.
You would have to be
Adaptable, would you say?
yes, very adaptable.
Okay.
You would have to have a very, very good memory.
What about being able to deal with different temperaments in terms of surgeon personalities, as well as x-ray techs and nurses, different personalities? Would you be able to adapt to those different types of situations and
Yes.
environments?
Yes, so working in an operating room, you're working with multiple people. So working with different personalities, some people might come in not the best of moods, so you will have to be able to adapt to whatever mood or environment that you come into.
Okay. What did you do before you became a surgical tech?
Before I became a surgical tech, I used to work at a drugstore called Savon's.
Okay. So were you working there straight out of high school or while you were in high school?
So I was working there while I was in high school and after I graduated up until I became a surgical tech.
Okay. And then what did you have to do in order to become a surgical tech?
So becoming a surgical tech, there are many trade schools that offer an associate's degree if you were to go into the program.
Okay, so it's not a certification. It's not a certificate. It's an associate's degree.
Yes.
Okay. How many years of schooling do you need in order to be a surgical tech? Is it 1 year?
It is 2 years.
2 years. Okay. And do you have to have any prior degrees or schooling in order to get into a surgical tech program?
The only thing you will need is a high school diploma or GED, and you would have to pass an entrance exam.
Okay. Do you love doing what you're doing?
I do. I love everything about my job.
Okay. What do you probably love the most about your job?
The best thing I love about my job is knowing that I did something good and knowing that the surgery is going to make a big difference with the person that we're helping.
So it's very rewarding in terms of what the end outcome is of what you're doing every single day.
Yes.
Okay. Did you have to take out a lot of loans to become a surgical tech?
Yes. I did take out some loans. When I went to school, which was about 13 years ago, it wasn't as expensive, but now I'm understanding that you're looking at maybe about a $30,000 loan if you were to go into this program.
Okay, but there's a lot of opportunity financially to work extra shifts and to work a little bit over like your normal shift in order to pay your loans back faster. Would you say that, or?
Yes. So they have what is called on call, which would make you you would have to make yourself available for the hospital, but you will be paid for every hour that you are available for the hospital, which is very rewarding.
Okay. Is there anything else you'd like to tell someone who's maybe interested in becoming a surgical tech, that doesn't know if that's something that they want to do in their lives? Is there anything else you'd like to say?
Yes. So if you do become a surgical tech, it doesn't just stop there. They have what is called a surgical first assistant, which is not available in California, but in other states they offer them, which you will be actually a surgical assistant with the surgeon. It is a great stepping stone for becoming an RN. Also becoming a PA. So the journey is limitless as far as becoming a surgical tech.
Okay, awesome. Thank you so much, Brandon. I appreciate it.
Thank you. I appreciate it.
All right.